So of course, age and dementia both are risk factors when we look at the impacts to COVID. So essentially, when we look at the aging population, chronic illnesses, there's a higher prevalence of the illnesses that make recovery from COVID a challenge. There's a higher risk of these in older communities. And then the same thing with the immune system. And this is actually the immune system, having a weaker immune system makes it so that you're more likely to actually have COVID and you not be able to recover as smoothly as someone with a stronger immune system and someone without chronic illnesses. So those together make it really just a challenge that has to be, has to be responded to and has to be acknowledged. Same thing with dementia. When we look here at more so at some of the behavioral challenges, because if you are having trouble accessing technology in a time of social distancing, when technology may be the only way to really connect with people and the only way to get information, those that are taking care of the people with dementia have to do have to take an extra step in assuring that they are able to access this information and get it to those who are not able to access technology in the standard ways that most people are able to. And same thing with the social distancing measures and hygiene practices that are heightened right now. Of course, this isn't to say that people with dementia don't already have, hygiene practices, but the fact that right now these safety procedures are increasing and there are things, such as using, masks when you go outside that are not a regular part of our day-to-day routine. And those who have trouble remembering new routines, need extra support in terms of actually protecting their own health and protecting the health of those around them. And there's increased stress and behavioral problems. There's a risk for that if they are, become COVID positive and have to seek treatment in a healthcare facility. Having that shift in their environment from their home or their healthcare facility, their home care facility, having to go to a hospital or to an urgent care facility can create increased stress levels, essentially, and impact their behavior in negative ways. Same thing with hypoxia, which is a symptom, one of the symptoms that we are seeing with COVID, hypoxia being decreased oxygen levels in the blood that can cause delirium. And again, another strain on behavioral challenges here. Some of the concerns that we've seen from elderly patients, just understanding the safety of leaving their house. So we have a lot of resources that exist out there explaining to people how social distancing works, but essentially making so that it can actually get to those that need it the most. Information on stocking food and medical supplies. Essentially, it's a caretaker's role, again, to make sure that this information is being shared with a person who is maybe homebound and needs to make sure they're able to access their food, have groceries in the house without making multiple trips to grocery stores and running risk of catching, being exposed to COVID in ways that they don't need to be exposed. And something that we're seeing here, of course, is that there are many people, not just elderly, but we're seeing this especially with elderly populations that may be neglecting their health conditions and avoiding the healthcare system altogether, avoiding seeking care, avoiding reaching out to caretakers because of the fear of COVID. So if they are able to kind of process and understand what's happening right now, there is a challenge of letting that be a source of anxiety that prevents people from really taking care of their health. And so really, again, the daily routines and the way that changes and can impact someone's health, whether it be health issues with the heart, whether it be weakness from, lack of exercise, whether it be the social isolation, just a lot of challenges here when it comes to how someone's daily routine is impacted by the pandemic. And same thing with the awesome ways that the healthcare system is responding through services like telemedicine that have existed before, but are more accessible. They're more robust. There's a lot of technological support there, but someone who does not necessarily use technology that often may still have challenges and need support to access these great resources. And so again, a few of the concern areas specifically for dementia patients, including want to highlight here, unsafe wandering, essentially that there has to be a closer eye on a patient right now that may wander a little bit because, you don't want someone to be wandering into interacting with other people, catching COVID, maybe spreading COVID. There's a lot of considerations there. Being able to still connect with their family and friends virtually. So it cannot just be as simple as saying that we're not able to, physically gather, and so that is the end all be all social interactions. Really, allowing people to in really supporting them in connecting with patients virtually with their friends and their family. Again, we've already highlighted the changes in routine and the behavioral responses that can come out of that. And same thing with understanding the new procedures of hand washing a little bit more often, covering your cough even more carefully than we have ever before, and things like this.